Okay, well, let's get started, and we're going to take a look. We've been talking a lot about lifestyle, so what's new? What can we tell our patients about lifestyle changes? And so we're going to take a look at some things like exercise and sleep that we don't usually, and a quick look at food plans. And I think the take-home point here is that our food plans, the American Heart Association, American College of Cardiology, American Diabetes Association, are saying our food plan thoughts ought to change. We need to counsel our patients to get more of their fat and protein from plants. And so as we go along, we'll see that this is a real paradigm shift for the United States. Okay, so what's the problem with our lifestyle? Well, if we look at this picture, you see our ancestors here came up, and there was the age of the hunter, the age of the farmer, and now we're up to us. We're the age of the eater. And we are that age, and we have become obese. So 37.9% of us in the United States are obese, and 70% of us are overweight from the latest CDC statistics. So again, we're getting larger and larger as time goes by, and it's not that we're getting taller. If we look at the real problems here, now this is the CDC and the American Heart, and every year they look at metrics. They look at the modifiable risk factor metrics. So they look at our, as a country, as our overall exercise, our smoking. We're doing very well with smoking, see? But if you look up here, here's diet. Oh, where's the green part? Oh yeah, that's a commune in Colorado. I mean, there's almost no green part up here for our food plan. And if we look at how these are progressing, and this is smoking, and we're doing much better at smoking, but oh dear, obesity, oh my goodness. If you look down here at physical activity, oh, not doing too well there. And if we look at food plans, oh, there it is down there, way at the bottom. We aren't even progressing at all. We aren't changing our dietary habits at all. And American Heart says that 65 to 70% of cardiovascular death in younger people is because of our poor food plan. Oh, look at it. So we have to do something about this. And so what can you and I do for our patients and ourselves? We have to get rid of the sugar-sweetened beverages, and that includes the fruit juice. So no orange juice isn't the thing I want you to have in the morning, despite what the Florida orange juice people say. You're better off, if you want to drink juice, drinking dilute juice. But again, soda is definitely out. These are high calorie and they have a low satiety factor. Sugar really doesn't make you feel full. You can eat a heck of a lot of sugar and a heck of a lot of carbohydrate, and you still don't feel full. So not a good satiety factor, too many calories, and it's making us die sooner. So everybody says, well, it's the problem with society. Well, I have to tell you, I stop at McDonald's when I'm on the road sometimes because I can get a reasonable food, and I know I'm not going to be poisoned. Well, they were having a sale on their little ice cream cone things. One was 99 cents and two were $1. Okay, how many of you could resist the two? I mean, for a penny, you get two. Oh, I confess, I bought two. But when I walked into McDonald's, there was a homeless man sitting on the bench. And so on the way out, I took mine and gave him the other one. So you just got to get rid of the extra. It's okay to say, wow, it's on sale, I'll buy extra. But you have to figure out how to weave the extra into your life so it doesn't end up on your hips, okay? So I bet that homeless guy had a lot of ice cream that day. The other thing is that they're saying society is sneaking stuff in. They're supersizing. They're selling a lot for an extra cent. They put in high fructose corn syrup. So as a group, we need to lobby in our areas to get rid of high fructose corn syrup, or to at least label it. And the HEB now labels things that have high fructose corn syrup. They'll tell you this is high fructose corn syrup. We need to get that into our communities so our patients can say, okay, I'm not going to buy this drink or this salad dressing that says I can use it and is great for me when it's full of high fructose corn syrup. which is metabolized a bit differently, and because of that, it causes more intra-abdominal fat and more insulin resistance than cane sugar. And it's interesting that the CDC, which has a campaign against high fructose corn syrup lately, says, is in Atlanta. And so is the Coca-Cola Company. If you look worldwide, the biggest seller of high fructose corn syrup is the Coca-Cola Company. And the CDC did politely make a little noise, and now the Coca-Cola Company has 2 of its classic products that no longer have high fructose corn syrup in them. So you can influence these people who are making a buck on high fructose corn syrup and sugar-sweetened beverages. So I think we all need to work on that because we know they cause diabetes, we know they cause insulin resistance, they probably even cause hypertension. No. They do? And soda is our biggest problem. That's the biggest thing that our biggest sugar and high fructose corn syrup related item. And no one really needs soda. And I remember Dr. Wells saying she's almost off Coca-Cola. I made my husband switch to the kind that doesn't have high fructose corn syrup. Okay, so the shape of things to come. Well, is society actually going to put a tax on soda? They've shown that if you put a tax on soda, people drink less. In foreign countries, in the United States, not so much, because we have enough money. We have enough disposable income, so it costs 10 cents more to buy the kind you like to taste better. And people just buy it. So not so much help for us. But we have to realize that poor dietary habits are killing us. And there's not going to be a tax on fruit, nuts, and berries. So again, we have to do this. You and I have to do it. We have to get out in our communities and be leaders in this. And you say, oh, I've heard enough of that. Thank you very much. Well, this is the dark side here. A sugar-free dark chocolate actually lowers blood pressure and improves endothelial function. You didn't mention the sugar. No, that's why I have to mention it. He doesn't talk about things like that. Okay. Also, of course, berries, nuts, fruits, and vegetables have polyphenols that also help endothelial function, so they help the inside of our arteries, help us prevent coronary artery disease. We talked yesterday a little bit about endocrine disrupting chemicals. Very important. They are man-made products or sometimes naturally altered products that fit into hormone receptors. And they are absolutely linked to childhood obesity, without a doubt. And probably adult obesity to a small extent. We talked about phthalates and plastics, about drinking your water out of the steel tins or glass. And people said to me, well, wait a minute, it's all delivered in bottles. What are you going to do about that? Well, actually, everyone's hoping that we're going to have more purified water that is stored in other ways that we can pick up and buy. But as yet, you're right, in the United States, most of the water we buy has been stored in plastic bottles for really sometimes a very long time. And unfortunately, phthalates are also in things like enteric-coated pills or IV tubing, and in the United States, still present in 40% of packaging in 2017. In Europe, they're doing a much better job of getting rid of plastic packaging. But again, just don't drink your water from the water bottle if it gets hot. Don't let it get hot in your car. Don't microwave in plastic containers. That's about all we can do in the United States at the moment. And if you want to know more about endocrine disruptors, take a look at the Dirty Dozen. It's a very nice, you can download the PDF. I've given you the website. It tells you about some things you can do to avoid phthalates in your life. Now, unfortunately, ACOG has just published a bulletin. I thought I'd put that out. House dust has a lot of phthalates in it and a lot of chemicals that actually can cause hypothyroidism. The polybrominated diphenyl ethers are known to cause hypothyroidism, and they are now being found in a lot of the house dust because they're found in carpets and upholstery. And so you either have to dust more often or breathe less in your house. Okay, the other thing that I always like to remind people who take care of pregnant women about is this old ad. It says, how soon is too soon to start cola? Oh no, the little guy can just guzzle it out of a bottle. But the problem is that pregnant women should not be drinking sodas. They particularly shouldn't be drinking high fructose corn syrup. They shouldn't be drinking sugar-sweetened beverages because of the microbiome. Remember, we're saying that the microbiome, the gut flora, actually are very important in preserving your life. They're very important in decreasing your weight, preventing metabolic syndrome. And where do you think the fetus gets its microbiome? Where do you think the infant gets it? From mom, obviously. And so if mom eats an unhealthy diet, the fetus pops out with an unhealthy microbiome. And you know where toddlers get their microbiome from? Mom, dad, and the family dog. If the family has pets, the child's with the toddler around the floor hugging the dog. Yeah, right. Well, actually, dogs in the United States have a better diet than mom and dad most of the time, so it's all right. Okay, so what are we looking for here? We like diversity in our microbiome. We like a lot of Bacteroides and proteobacteria. We want to have those because they make short-chain fatty acids that decrease gut permeability. If the gut is permeable, then the inflammatory factors, the problematic factors go into the bloodstream, our HSCRP goes up, and if we have Bacteroides, mucinophil acromantia is one of the ones that helps decrease the risk of diabetes by decreasing gut permeability. Firmicutes is the one you get when you drink sodas, when you eat high-fat food, and that does not produce the chemicals that decrease gut permeability. So you have a leaky gut. So if you eat a lot of high-fat food, you get a lot of inflammatory factors from the red meat you eat, and it goes to the liver, and you get cirrhosis. We know that fatty liver, particularly in patients with diabetes, is secondary to the transport of inflammatory factors and fats through a leaky gut from a bad microbiome. We've known that for several years. So again, try and work on your microbiome. You need to get less fat and less sugar into your gut. And how can you do that? You say to me, I want to go out and buy it so I can take it. Because we all want to just dump something down and cure the problem immediately. Better not to, better to use probiotics and to use yogurt that contains actual active cultures. You want lactobacillus and you want Bacteroides and bifidobacteria. So bifidobacteria and lactobacillus. So you say, I'm going out and buy some of those products. Well, when you buy, look on the label, you want lactobacillus and you want bifidobacteria. Okay, so how's another way to approach the problem? We've got to get our patients to exercise and choose their foods wisely, and the CDC tells us our big problem is portion control. And the CDC website is one of the best places for you to tell your patients to go. It's called choosemyplate.gov. No spaces in there. So choosemyplate.gov. It gives you pictures of portion sizes. And even children, they've experimented with children. Children can actually look at these pictures and go through a tray line and pick up the proper portions. The problem is that adults going through the tray line, having looked at the pictures, still eat more. Well, what can I say? We're not as good as kiddos. But, anyway, this will be a very good place for your patients to go and take a look and find out the size of a portion. Yes, exercise. That's the art of converting big meals and fattening snacks into back strains and pulled muscles by lifting heavy things that don't need to be moved and running when no one is chasing you. And in 2018 in January, these are published in the JAMA, we actually have new guidelines for Americans. And the British Medical Journal had an editorial the week these came out saying, this is a desperate country that can't get people up off the sofa. And the reason is the top line here, look, adults 150 minutes to 300 minutes a week of moderate intensity exercise. Now that would be, walking at a brisk pace, Oh, that's a lot. 300 minutes. That's 5 hours. Oh my goodness. How many of us actually exercise briskly 5 hours a week? Turns out when they looked, about 15% of Americans over the age of 40 do that. Oh dear. Well, muscle strengthening activities 2 times a week. And finally, this time they said in older adults, balance training, very important. We saw the other day when I talked about osteoporosis, how important balance training is for you and your patients. It decreases the risk of hip fractures markedly. Actually, if you do it properly, it decreases the risk of hip fractures more than bisphosphonates. I hate to tell you that because I'm an advocate of bisphosphonates. It really does. In Japan, the hip fracture rate is very, very low. And it is low because no one lets the elderly fall down. The family would be just, horrified if grandma fell and broke a hip. They assign the teenagers to make sure she doesn't. So again, we need to look more at fall prevention. We need to look more at balance exercises in our lives. And pregnant and postpartum women should do at least 150 minutes of moderate intensity aerobic activity a week. When you're in your 3rd trimester, I don't exactly know how you do that. You have to waddle a heck of a lot faster to get moving here. So the reason the British laughed at us is down here. It says, moving more and sitting less will benefit nearly everyone. So they're saying if you can't do all this other stuff in the top section, the 5 hours a week are impossible for you. Just get up off the sofa. And it said people who are on the sofa most of the time will get most of the benefit by getting up and walking around the sofa several times a day. And I don't know how many of your patients have these, but a bunch of mine have them. They have these watches that tell you when to get up. You know, your watches or your phone, and you'll be sitting in the office with them, and all of a sudden the phone will go off, and they'll say, oh, my phone is telling me I have to stand up for about 5 or 6 minutes and walk around. Okay. I think their brain is somewhere outside the office. So what does exercise do for us? We know it decreases visceral fat. Visceral fat equals insulin resistance. So we know it helps us. It improves cognitive function. It improves cardiovascular health. So you really have to just move it, and you'll be better off. It also signals commitment. And it turns out that in our obesity program, we talk to people about this because if you know that you have to walk 3 miles to get rid of that blueberry muffin you had this morning, you may eat only half of it, because you have to plan your day. And if you're not going to be able to exercise enough to get rid of the calories you consumed, you're going to gain weight. So we tell people it gives you an idea of how much you have to do to cover the food that you've eaten. And that's very helpful in the overall scheme of things in maintaining your weight. How to implement exercise? Well, we tell our patients, you talked about implementing clinical change yesterday. We tell our patients, prepare for this. First of all, you're just going to select the exercise and the equipment the first week. You're going to decide, what am I going to do? The next week, you're going to find time for exercise. And when you're talking about the contemplative phase and the preparation phase of clinical behavioral change, you're talking about finding time, because that's the biggest problem. I say, Mrs. Schmedlap, can you exercise? And she says, oh, come on, doc, I don't have any time for that. Right. If you don't have 15 minutes a day, now remember the new guidelines, they're just saying we can do this in short increments. You don't have 15 minutes a day to yourself to exercise, there's something wrong with your life plan, and we've got to fix it, because everybody should have at least 15 minutes. You can meditate while you're exercising and sort of just get both of them done at once. Week 3, we exercise for 30 minutes 3 times a week. Week 4, again, you're going to exercise 30 minutes 5 times a week. You can either use the same amount of time and walk faster, or you can walk the same speed and do it more often. But we get you moving. There is no one that I start out in an exercise program and a food plan that doesn't do something. So it just takes a lot of thought and some counseling, but you can get people moving. The other thing that's come out this year, and we're supposed to be thinking about that, is sleep. Because if you have sleep restriction, your hormonal milieu changes to the point where the hungry hormones are higher, the ghrelin. And when we eat, the ghrelin goes down, and after a few hours, it begins to go up again in the bloodstream. It's a GI hormone, and it says, oh, you're hungry. On the other hand, PYY, after we eat, goes down. It says you're full, and it goes away 2 or 3 hours after you eat. So if you don't sleep well, the ghrelin goes up in the bloodstream, it's higher in the bloodstream all day long, and you feel hungrier. So people who don't sleep as well and who don't sleep as long have an increase in appetite. They studied that pretty carefully. It increases in hunger and appetite when you're a short sleeper. You also have reduced leptin. So again, your hormones are disrupted. And disrupted sleep is very important in terms of unhealthy eating. To say nothing of the fact that a lot of my patients who have insomnia get up and eat in the middle of the night. So they say, well, I'm up anyway, I'll eat some ice cream, I'll drink a Coke. So again, the sleep medicine people tell us we really need 7 hours of sleep. And unfortunately, for most of us, you cannot catch up on the weekend. You can't say, I'm going to sleep 6 hours a night when I'm on call, and then on the weekend I'll catch up. It unfortunately doesn't work that way. Your hormones don't reset as well. So short sleep duration independently associated with weight gain. And whatever you do, don't be on call at night. Because people who work the night shift have totally disrupted GI hormones setups and don't do well. In general, they have a higher risk of obesity, diabetes, and cardiovascular disease. But even worse than the night shift is the split shift. I try to get all my patients off that as soon as possible. That totally disrupts your sleep-wake cycles. Okay, so we're going to talk as we finish up about nutritional therapy. So what do we want to do with food plans? We want to prolong life. We'd like to provide adequate nutrition, and we'd certainly like to prevent disease and stay at a reasonable weight. So my patients say, well, forget that food plan. I'm just going to take some pill. And I say, well, I don't think we're going to do the pill without the food plan and the exercise program. They say, I don't need you. I'm going to take one of these over-the-counter things. Over-the-counter things come in two kinds. The dangerous ones, which are over-the-counter amphetamine-like compounds, are called natural amphetamines, and they cause death in a significant number of people who take them. The other over-the-counters are safe, but not very effective. They are the swell-up in your stomach things like hydroxycut, and that's one of the most popular ones. It's a cactus. It's very high fiber, swells up in your stomach, and you don't eat as much. So they're okay, but they're not very effective. So when we look at over-the-counter supplements, I want you to urge your adolescents and everybody basically to be very, very careful and avoid these amphetamine-like compounds. And this is a study done looking at, by the National Health Review, about boys and girls in middle and high school using weight loss products that contained natural amphetamines. And this is, I looked at this and I said, okay, wait a minute, how did this work out? These are age 0 to 25. The zeros were pregnant women, and they counted if there was an adverse event for the pregnant woman. They also counted it as an adverse event for the fetus. So that's how they got the zeros. But looking at that, just the bottom line here, 977 reported adverse events. There were 166 hospitalizations, 39 life-threatening events, and 22 of these young people died from taking these amphetamine-like over-the-counter supplements. Please warn your patients not to use them. If they want to use the kind that swell up in your stomach, the kind that give you a decreased transit time, that are high fiber supplements that cause you to have more bowel movements, just have to be careful you don't get diarrhea in those and you don't get hypokalemia, but those are the more safe type. You definitely want to avoid the unsafe amphetamine-like compounds. Okay, I know what to eat, right, but then why don't you? No, it's portion control. Now, interestingly, let's take a look here. This is the USDA 2015 Dietary Guidelines, and these people are hastily working on new guidelines. As you know, guideline committees take years and years. These people are trying their best because of the embarrassment of these old guidelines. This is a 2015, that wasn't too long ago. They said, okay, we want a high carb diet with not a whole lot of sugar. We don't want much saturated fat. But look here, it says protein, 2/3 animal, 1/3 vegetable. They are so embarrassed by these guidelines that I can't tell you, they just don't want to even discuss them. And of course, then the food brought to the usual clinic. This was the luncheon we had for a lady who'd been working at our clinic for 40 years. She's a nurse who'd been there for 40 years, and she's one of the nicest people I've ever met. So we tried to poison her with lunch. They brought a hamburger tacos with high-fat wrappers, and there were a lot of different kinds of cookies and pies and chips. And if you looked, it had, low protein, low fiber, high fat, red meat, and more than about 3,400 milligrams of sodium in the average serving. So, what do we know, and what's the plan? Well, the CDC literature, I think, is probably the best, and they have a lot of things you can give your patients on that choosemyplate.gov website. It's really an excellent website. Well, let's kind of look at a few things. We need to eat protein, about 0.8 to 1 grams per kg per day. Unless we're heavy exercisers, athletes, at least 1.5 grams per kg of body weight per day. And again, we're going to need those for muscle maintenance, for heart maintenance. And the big question here is how much animal protein and how much vegetable protein? This is an interesting cultural study. And these were two cultures. These weren't people that went on a food plan or a diet for a week. These were two cultures that ate different amounts of animal and vegetable protein. And there was a 26-year follow-up in this study. This was the way these people lived. That was their culture. And it turns out that all-cause mortality, higher all-cause mortality, was associated with an animal-based diet. So if we look here, these are the people with high vegetable fat, 21.1%, animal fat, 15.5%. So they were getting their protein mostly from plants. Remember, you get most of your fat when you get most of your protein. And so if you eat a lot of animal protein, you're going to get animal fat. If you eat more vegetable protein, you're going to get vegetable fat. So here we are, and the animal fat folks, 17.1% vegetable and 26.3% animal fat. So these people died sooner of all causes, cancer, heart disease, diabetes complications, than the people who had the more vegetable fat and the more vegetable protein. But they weren't vegetarians. These guys weren't vegetarians. I mean, they had animal fat. They just had more vegetable fat. So we don't have to convert the whole society. As my patient said, I'm not going to eat that couscous stuff. I don't care what you call it. I'm just not going to eat it. And there's the polenta. What the heck is that? Okay, so we don't have to be vegetarians. We just have to sort of shift our thinking. So the other thing that is really changed over the last year or two is a more fiber recommendation. They used to say 25 grams for women and so on and so forth. Now it's 30 to 40 grams a day. You really ought to get more fiber in. And of course, if you eat most of your protein as vegetable protein, you will have more fiber. It just comes with the territory. We know that fiber increases insulin sensitivity, it decreases cholesterol. It's good for us. Now, the rest of this time, we're going to take a quick look at a U.S. News and World Report, one of my favorite scientific publications. But every year, these people get together, a group of truly scientific people who know a lot about food plans and diets and health. They're from the American Heart Association, the American Dietetic Association, the ADA. They run large nutrition centers and they do nutrition research. So get this group together and they rate diets as to how healthy they are and how likely they are to help you lose weight. And so this year again, the Mediterranean diet worked. And so look at it. I mean, I know we've looked at that every year here, but let's look at it with a new eye. Where are we getting most of our protein and most of our fat? From the bottom part, from plants. And certainly we have cheese and yogurt and fish and meat. Oh, red meat, a few times per month. Oh dear. Well, we can eat fish a few times per week, and if you noticed on Dr. DePetty's chart, they advised we eat more fish. They have omega-3 fatty acids. They have, so they have some good unsaturated fats. This emphasizes olive oil that has monounsaturated fat. So this is not a low-fat diet. The Mediterranean diet can be up to 35% fat, if you want to schedule it that way, but most of the fat is plant fat. And much of the protein, as a matter of fact, if you follow it closely, most of the protein is from plants. Is it a vegetarian diet? Heck no. Now, again, Mediterranean diet is a very healthful diet. It's high in fiber, 32 grams, 20% protein, and average about 29% fat, but you can ratchet it up to 35 if you increase the olive oil in it. It prolongs life, most definitely. It's the only diet we have very good information about prolongation of life. And overall, the latest meta-analysis showed that its focus on plant-based protein and fat reduced cardiovascular events equal to that of pravastatin. This is compared to pravastatin. So equal to a modestly effective statin. Now the next diet they gave, number 2, was the DASH diet. You'll be happy to know that. So that's been used for hypertension for a long time. And what that does is allow more dairy products than the Mediterranean diet. The dairy products in the Mediterranean diet are kind of above the olive oil, but they were below, and they're more recommended than the meat, but they are not prominent. And this has more prominent dairy products. If your patients still want to use plant-based, they can use almond milk, soy milk, that sort of thing. So they can still be pretty much plant, majority of their protein coming from plants, but a little more dairy if you're into dairy. And also, of course, the DASH diet restricts sodium, and it says start out with 2,300 milligrams and go down to 15. 23 is pretty easy in the United States. You can actually buy canned things and frozen things and still have 2,300 milligrams. Get down to 1,500 milligrams, takes you a long time in the supermarket. You really have to look around. You can buy frozen things, but canned things. Chef Boyardee, by the way, is poisonous, just as an aside. It has 2 grams, 2,000 milligrams of sodium in each serving of those little cans. So don't eat that. Obviously, I'm not sponsored by Chef Boyardee. It also says you need to exercise and Tai Chi. The DASH diet this time had Tai Chi for 30 minutes. That's a balance exercises. Meditation for 30 minutes. Do you know that Tai Chi and meditation help the endothelial lining of your arteries function better? So they're knowing now that, yes, you need to do some other things than change your food plan, okay? The flexitarian diet came in number 3. Flexitarian diet has 32 grams of fiber, tells you about sodium, and it allows you more meat and more dairy. So we're adding fewer plant things and getting more animal things, more animal proteins as we go down the list here. The MIND diet, I just wanted to mention because this has about 3 studies showing that if you have early Alzheimer's and you follow this food plan pretty carefully, it can slow down the progression. Now, what do all these other pills we're taking do? Well, they may slow down the progression. They just may help you function a little better. But this has some pretty good data. So you might want to talk to your patients about it. and it is low cholesterol. It's 38% carb. It's also a lower percent carb diet than any of these others. If you want a low carb diet that's pretty healthful, this is a pretty good one. Again, you can find this on the CDC website. Protein, 26%, mostly plant, but you're getting more animal in there, and fairly high fiber. You're not going to be constipated on this one, folks. How about Ornish? We know that Ornish can actually remove plaque from your coronary arteries, but it's very difficult to follow. You can see why. 71% carbs, 1.5% saturated fat. Now, that means that a piece of hamburger might drop into your soup once a week. I mean, it's really. They also emphasize meditation, yoga, and exercise, and calcium. This is the first one that tells you how much calcium to use. So it's really good for preventing diabetes, for decreasing coronary artery disease, but very difficult. Most of us want more fat than that. Sorry about that, Ornish. Okay. So how about if your patient wants to use these food plans? They want to use the, I want to buy it over the counter. I want to bring it into the house. I want to just use a protein supplement. The Weight Watchers was the best weight loss food plan there was. They said, Weight Watchers, far and away, if you want to eat real food, use Weight Watchers. It has adequate fiber, it's low fat, it's high carb, it's reasonably good. Rapid weight loss, where you want to use a powder or a potion, the HMR has been around for a long time. It is an animal-based food plan. It uses whey protein from dairy in its supplements, but it had the best sustainability of any of these rapid weight loss. Your patient says, I want to just take these drinks. HMR is the best one, and you can go online, and they have a whole program. You can actually buy it online, or you can go to one of their centers. Okay, for weight loss, calories count. And if you look at Zone and Atkins, which were rated really pretty low, they were 37, Atkins was 37th place out of 41 rated healthful food plans. Remember that they're not sustainable. These low carbohydrate diets, in the opinion of virtually everyone, don't show sustainability even at a year. They just don't. People don't stay on them. They're not particularly helpful with for patients with diabetes and cardiac disease or significant renal disease. They're too low carb, they're too high protein, and they have too much fat. And people can argue with me about that, but this is the group that said this. The keto diet was rated 38th. They said, please, the protein is adequate, but the carbs are much too low. And I found my patients, when I look at them and talk to them about the keto diet, they say, I'm on the keto diet. I say, okay, what do you eat for breakfast? He said, I eat no carbs. You know, what do you have for breakfast? Well, I have my strawberry, kale, and rutabaga smoothie. Pardon me? What do you suppose cauliflower, broccoli, kale, artichokes, rutabagas, and strawberries are? You think they're meat? So, no. So they're frequently eating a lot more carbs than they think. But you need to ask them very carefully, because if you're on less than 50 grams of carbs a day, your autonomic nervous system goes to pot, your hibernating myocardium can become ischemic. You just don't want to do that. So the keto diet was rated really low. They suggested healthy 1.8 out of 5. So again, but if you look at all these that we've looked at, it doesn't matter how much fat you have, how much carbs you have, how much protein you have. If you want to lose weight, only the calories count. These are all very, very different fuel sources, and yet they achieve the same degree of weight loss. Only the calories count. Doesn't matter if it's low fat or high fat. This is a really nice meta-analysis showing that the fat content had absolutely nothing to do with the weight loss. It was only the calories that counted. Ketonic diets, remember, don't use in type 1 diabetes, patients with albuminuria or renal insufficiency, because you can get acute renal injury using these. And again, coronary artery disease, probably not a good plan. So, as your patients say to you, I found this diet, and they always find it at 4:30, and they've got it on their phone, and I can't, I can only see little bits of it. I'm trying. Well, so at any rate, you want to tell them your homework is to go home and make sure that it has adequate protein and that at least half of it is animal and half of vegetable. Or if you're really going to be good, 2/3 of it is vegetable and 1/3 of it's animal. But you certainly don't want these people eating 2/3 animal and 1/3 vegetable protein, because that's going to make them live shorter, not longer. So try to get them to have the majority of their protein and their fat come from plants in this diet they found. So you want to take a look at that, but they have to have adequate protein. That's the bottom line. Low saturated fat, some monounsaturated fat, a lot of fiber. We're talking 40 grams of fiber. You want to lose weight, you got to keep your transit time moving. And for patients with type 1 diabetes, you have to have enough carbs. Okay.